Welcome to another segment of ACRP TV. Today, our spotlight is on creative ways to predict patient engagement, a very important topic indeed. My name is Michael Causey. I'm the editor-in-chief here at ACRP. We've got with us today Lynne Becker, who's the CEO and founder of Power of Patients, and she's got a cool backdrop there just to prove it. Lynne, thanks so much for joining us today.
Thank you. Thank you. I'm excited to be here.
Yeah, well, great. Let's just jump right in and talk about this. So you and I talked a little bit earlier before we got on camera here, and you talked to me about, different buckets and different types of patients and ways to look at this. And so if you could just jump in, tell us about, some of your philosophy on how to do this better, maybe some things we're all overlooking here.
Right. So little background, I've been doing it for well over 20 years, technically 25, but that makes me sound really old. So I prefer to say 20 plus, right? Gotcha. So I've seen so many different kinds of research trials. And when I was recruiting for them, before even managing them, you would go out into the trenches and you would talk to people. And you would quickly learn, some people would just blow you right off. It's no different than our digital media now. Some people don't even bother to stick around. But other people will sit there and be very engaged and chat with you. And then others will hover. They won't say anything. So you have these three buckets of people right there that were very obvious to me. And so I always wanted to give everybody, their attention that they needed and be very respectful. And I have seen that same pattern translate across every research project. And being able to identify that is key, because that's part of the success of your recruitment and engagement. And that can translate into the digital world.
Now let's talk a little bit, we've got limited time here, of course. I want people to get a flavor of what you're doing, and maybe they can reach out to you later to get more information. But you're talking about, broadly speaking, three different types of people. I'm assuming there's three different types, at least, of approaches that work best with these kind of patients.
Exactly. So what became the norm for clinical trials was this whitewash of just a barrage of data that was being sent to them for recruitment materials, and you have to engage this way. And it was just done to everybody. Nobody had any kind of specificity to the kinds of patients that I just profiled for you. And again, these are high level, right? Categories of people. But rather than what I discovered as I was doing this is, rather than keep whitewashing and putting all of this energy, all of this money, all of this wasted effort on people that were already very highly engaged, and we call them stakeholder analysis. You can call it grit, which is perseverance and passion and all of that good stuff all together. But rather than just whitewash everybody, you can figure out how to easily target the people that really need the hand-holding. So what also is going to happen? Let's say you get those people who were hovering and they were interested, but they didn't really want to talk to you yet, but they did engage and they did register. There's a probability that they are going to disengage. But that's the person that you want to give more effort to, more interest to, and you want to handhold them through. And by doing this little simple analysis, it's so simple. It's like, why didn't we think of this before? The V8 moment on your head. And it's a great technique that works. And you just nurture them through the whole pathway and they stay engaged and you don't lose them.
All right, before I let you go now, so in addition to calling you, what's a good first or second step somebody should do if they're trying to get their arms around this, if they're at the beginning of the stage and they've never really approached it this way?
Besides calling me, which I'm happy to help, look at your population, right? So we all have very specific and general categories of what is my inclusion exclusion criteria, but you need to take it a step further, because we often want to go into certain cultures or ethnicities and things like that. And you have to embrace that. And listen, I recruited the Gullah Geechee men, which are direct slave descendants off of the coast of South Carolina. And they literally told me, get out, leave. You're white, you are pregnant. I was pregnant, my daughter, and your blue eyes, and we don't trust you. And it was my second project when I moved to South Carolina from California. And I was like, I'm a really nice person. This is a really good project. What? I only needed 6 men on my study. It took me 6 months, but I listened to them. And that is also the key, right? You have to listen. It took me 6 months and they embraced me and our team. And we had 330 men on our study. And that was my defining moment about these buckets of people. They all came around. It was 100% engagement.
Wow.
Yeah, so it's doable. And I reproduced it on a zero budget with my Power Patients, all digital, launched in COVID crisis mode. And in less than 4 months, we had over 400 people. So you're able to do this digitally as well. And our engagement rate digitally is 72%. So it's doable and it's very simple. So the takeaway is you talk to the people, you know what bucket they're going to belong into when you have these conversations. And it's not an intake like what you do with the IRB. It's just truly a conversation. And make sure you apply the resources appropriately to the people in the certain buckets. So there are 4 buckets, but the 3 are very easy to digest. There's always that 4th one, but I'm happy to help and share with people, these techniques.
Oh, fantastic. That's fascinating. Very inspiring. That just sounds key to that. You said the word conversation, which sounds, it's obviously about communication. It's not a high level technical thing at the outset. So you got to establish that connection. That's fantastic.
The trust. And that's what it boils down to. Yep.
Yep. Fantastic. This has been our ACRP TV Spotlight on creative ways to predict patient engagement. We've been speaking with Lynne Becker, who's the CEO and founder of Power of Patients. Lynne, thank you again so much for joining us. Really a great segment. I appreciate it.
Loved it. Thank you.